What causes inconclusive bladder molecular marker results? Imagine trying to solve a puzzle where some pieces look very similar, making it hard to see the full picture clearly. That's often what happens with inconclusive results from bladder molecular marker tests. These tests are designed to detect signs of bladder cancer by measuring specific molecules in urine or tissue samples. But sometimes, the results aren't clear-cut, and that's mainly due to a few key reasons. First, benign conditions like infections or inflammation in the urinary tract can interfere with the test. When you have a urinary tract infection or irritation from stones, your body responds with inflammation. This inflammation can cause changes in the molecules or proteins in your urine that mimic those seen in cancer cells. So, the test might show positive results even when there is no cancer, leading to false positives or inconclusive outcomes. Second, previous treatments or medical devices can also affect the results. For example, if someone has had bladder treatments like Bacillus calmette-guerin therapy or uses an indwelling catheter, these can cause changes in the bladder lining. These changes can alter molecular marker levels, making it harder to interpret whether the results are due to cancer or just treatment effects. Third, the technical aspects of the testing process itself play a role. Different laboratories use various methods and thresholds for what they consider a positive result. Some tests set higher cutoff values to avoid false positives, but that can also mean missing some true cases. Conversely, lower cutoffs might catch more potential cancers but also increase the chance of inconclusive or false results. Variability in assay sensitivity and specificity can make it tricky to get a definitive answer every time. Another factor is the nature of the tumor itself. Molecular markers tend to be more reliable in detecting high-grade or more advanced tumors. Early-stage or low-grade tumors often shed fewer markers into the urine, which can lead to false negatives or inconclusive results. This means that even if cancer is present, the test might not pick it up clearly. Lastly, many molecular markers are still under research and haven't been fully standardized for routine use. Different labs may use different panels of markers or testing protocols, which can impact the consistency of results. Because of this, inconclusive outcomes are common, and further testing is often needed. In practical terms, these inconclusive results highlight why molecular marker tests are best used as part of a comprehensive evaluation. They are helpful tools but cannot replace procedures like cystoscopy or biopsy, especially when results are uncertain. Often, additional tests or repeated assessments are necessary to confirm or rule out bladder cancer. Ongoing research aims to improve these tests by combining multiple molecular signals, such as DNA methylation patterns, proteins, and microRNAs, to make results more reliable and reduce ambiguity. Overall, inconclusive bladder molecular marker results reflected the complex biology of bladder cancer and the limitations of current testing methods. They reminded us that diagnosis is a process that involves multiple pieces of information, including clinical examination, imaging, and laboratory tests. If you're undergoing testing, it's important to discuss what your results mean with your healthcare provider, who can interpret them in the context of your overall health and symptoms.